To soften your impression, place under hot running water. Check the fit and extension of the lower tray in the patient's mouth. It is helpful to ensure you use Vaseline on your gloves and on the patient's lips to stop the impression sticking to them.
The temperature of the water should be about 60 to 65 degrees centigrade. Now, we don't use a thermometer to measure this temperature. Instead, place your hand in the hot water, and it should feel that you can keep your hand there for about 5 to 10 seconds and have to remove it.
Roll the impression compound and load your tray. Remember to place it back in warm water to make sure that the impression compound remains softened. When the impression compound is sufficiently soft, then place in the patient's mouth, applying reasonable pressure to achieve a detailed impression of the lower ridge. Remember, support the patient's lower jaw when doing so. When in position, you can then use one hand to support the tray and the other to move the cheek in the aim to achieve border moulding.
You should ask the patient to protrude their tongue, touching the upper lip, and extending their tongue left and right. Border moulding does not consist of pressing the cheek against the compound. The best way to border mould the compound impression is to lift the cheek and move the cheek from left to right.
Examine your impression. Look for any deficiencies. Examine the border extension and border moulding. Has the retromolar pads been included on both sides? If the impression has a shiny appearance, then it has not extended to the functional depth, and so ideally you want to see a matte border on your impression.
Now, the impression had a slight deficiency in the lower right distal lingual area, and it was necessary to add further compound to the impression. So when you've added the additional piece of compound to the defective area, then replace the impression back into the hot water. Now, it's important that you don't soften the whole of the impression, just the area that needs readapting to the patient's tissues.
Smooth out any bumps that this addition may have made. Again, re-soften the impression under hot running water. Repeat the impression for the particular area.
Now, this patient has quite an extensive lower ridge in terms of its height and its width, but often you'll need to take an impression for a patient who has a resorbed lower ridge. And here we use a wash impression which is added to the compound. Dry the compound impression with some tissue paper, and then we add some adhesive. Allow that to dry for about 30 seconds, and then we add a thin, low viscosity mix of alginate. So now we can place the impression with the alginate back in the patient's mouth and border mould as before.
When you have a satisfactory impression, use a Chinograph pencil to draw a line on your impression.
The compound impression will always be overextended by 2 or 3 millimeters. This is because the compound is an extremely viscous material. Therefore, when you're marking the outline of the special tray, this should be about 2 to 3 millimeters short of the deepest extension of the compound impression.